I'm Rebecca Matthews, presenting on behalf of the DENTAQUEST Partnership for Oral Health Advancement. Our topic today is the Teledentistry Educational Campaign for Health, or TEC. TEC was born out of the need for provider guidance on best practices for teledentistry during the COVID-19 pandemic. The project has two main objectives. First, to build an educational plan supporting use of teledentistry with emphasis on patient engagement, population health management, and access to care. Secondly, to encourage successful and lasting use of telehealth and oral health care. Our planning process initiated with a complete scan of the environment and gap analysis to identify where we could highlight person-centeredness better in public health settings within teledentistry. Our team focused on a project schedule to meet weekly in April to develop the content. A campaign strategy for promoting the resources was developed to support a staggered release of content between May and June. Supporting teledentistry use with the emphasis on patient engagement and population health management are our key messages, with our target audience focusing on dental providers as well as dental organizations. The partnership's website, monthly newsletter, and social media promotion supported material circulation. Additionally, content was integrated into messaging via DENTAQUEST website, blog, and additional communication sources. The DENTAQUEST Partnership Learning and Digital Dashboard automatically collected all data. The team created two main categories of resources. First, those to address provider education about teledentistry, as well as tools for providers to use to enhance the patient engagement in using teledentistry. A couple of examples of these patient engagement resources are a self-care tip sheet for after your teledentistry visit, the teledentistry self-management goals menu, and an upcoming webinar focusing on patient communication of self-care options to enable providers to effectively and comfortably talk about care options and safety precautions with their patients. Looking at the provider education resources, first, the Fast Track to Teledentistry white paper created at the start of the pandemic to help providers understand how and why teledentistry works and their care options for its use. Next, the approaches to prioritizing care in response to COVID-19 gives dental care teams support in identifying patient health and risk status to drive decision-making on appropriate care pathways using in-office and teledental service modalities. The teledental emergency visit pathway helps to visualize the care pathway and interaction steps for an emergency visit. The Bringing Teledentistry into Practice webinar series, as well as a video recording called Answering Dental Emergency Calls Remotely to portray correct, private, and patient-engaging methods for conducting remote synchronous consultations for emergency patients. Overall, the most highly utilized resource to date is the Bringing Teledentistry into Practice webinar series with a total of 934 combined participants. The PDF documents that are downloadable had a total of 547 downloads, the majority of which being the teledentistry white paper. Also, the Answering That Dental Emergency Call video had a total of 506 views. The tech resources were also incorporated in DENTAQUEST monthly newsletters, reaching over 11,000 individuals. In terms of next steps, we have a couple of plans for the tech content. We want to use tech to help to expand education in three ways: using the content within learning plans and virtual education sessions with group audiences, creating an interactive practicum for dental providers to build upon the content of tech to make the teledentistry learning experience more interactive for both individuals and in group settings, and then piloting the tech content within our COVID-19 Oral Health Recovery and Transformation, or CORT, project, which is a care improvement initiative. Finally, our conclusions. First, the team was able to quickly recognize an opportunity and collaborate very rapidly. A variety of content, videos, PDFs, webinars, leading to a robust webpage full of resources. Next, the COVID-19 pandemic lent to quick development and high utilization of teledentistry resources. The tech content is differentiated by its attempt to focus on patient engagement and approach teledentistry as a permanent aspect of care pathways useful across the dental care team. Additionally, testing and evaluation of the resources are critical to maintaining their relevance. As tech becomes a mainstay, iterative updates and new resources will enhance the value of it. Finally, digital health and virtual learning are requiring us to think about care and education differently. The lower number of downloads of our PDF resources compel our team to find new avenues of promotion and to make them more interactive in nature. The content reviewed here can be found on the DentaQuest Partnership's website at www.dentaquestpartnership.org.